Dear friends, as we are approaching the end of this presentation on cervical cancer, the cancer of the cervix, let's see the following presentation, which should be also short, summarized, where we are going to talk about the, the complications, the complications of cancer of the cervix. Let's see it in short before we see the treatment, then we see the treatment modalities. We are going also to examine it by answering the last question, before the last question, which is the consequences or the complications. If this cancer is not diagnosed on time, if it's not treated on time, what will be the complications? I think if you follow the previous presentations, 1, 2, 3, 4 on this chapter, you can see clearly where it is heading. So we remember that cancer of the cervix can start with an early stage without knowing. Once now it starts getting scattered in many places. You see, stage 1, it's just located. It's located near around the cervix, from the vagina. It is still located. But stage 2, now it is trying to run in the proximity, of the vagina, the uterus, in the pelvis. You can see where it is. The cells are scattered. They're showing us in red. You can see now stage 3. Oh, it's very bad. It has gone very far. It is into the lymph nodes. It is in the near the thighs. It is progressing to the vagina. Outside, it is even reaching the vulva. Outside, this one will be in the bladder. It can go to the what we call broad ligaments. So the number 4, the stage 4, is very cruel because it will even move far to the lungs. You can imagine if these cells were able to block the ureters from the kidneys, the urine are no longer able to come out. Part of the complications, you can imagine what would happen. If it is in the lungs, it will suffocate someone because it will block all those small cells. Not only that, it will be on the liver, it might go in the intestines, it can cause many problems if it reaches this stage. One can understand. This also, if you keep this image in mind, it is going also to help on the treatment modalities. We can see now if it is still on stage 0, there are no cells, there are no malignancy, survival within 5 years in 99%. All people, without considering other causes of death, people should survive at 99%. While stage 1, survival is 75%, meaning it can kill 25% of those who contracted this cancer. Those who have already stage 2, which means they are here on this stage, it's already bad. It's a criminal stage, so which means it can kill almost half of the people who reach this stage. Stage 3, only survivor is 30% within 5 years, meaning 100 women who have cancer of the cervix, and you count 100 of them, only 30 will survive. This slide is not for scaring anyone. It's just to tell us that there is a possibility to prevent to reach this stage. We can stay, all women, whoever is following this presentation, it is highly possible to stay on stage 0. It is possible. It's a matter of applying what we are going to discuss now. Stage 4, which is the last one, where we spoke about metastasis, goes to the lungs, to the liver, to the all organs, even bones. This stage is very bad because the possibility of surviving is only 7%. So this shows how much this cancer is very serious. that shows how much everyone should take part in fighting this um, cruel disease that is ruining lives of our sisters, our mothers. We need to be very careful and take action. Health professionals, it is our responsibility. Politicians, yes, you can do something. You, the population at large, it is also our problems together. You can do something by responding positively to the most messages that you receive. Remember the multiplication of the cell. If a cell is already damaged, it has the gene of cancer inside. The multiplication is very fast. It will bring tumors which will cause problems. And when you do your examination, you will start seeing those cells. Some of the ways they can now diagnose it and confirm that this is the one before the complication comes, they can take punch biopsy, they take a tissue, or they can do what we call cone biopsy. They just go and cut all the part that was sick, and they remove this sample, which is taken as well to laboratory for checking and confirming. And this will be checked every every year or every 6 months to check if the cells are still normal. If they are not, nothing was left over. So we need to remember the lymphatic system, which keep on draining those type of cells, which will fight with the antibodies, the defense mechanism of the body, which will cause the what? Adenopathies. They will swell. They will swell. As the cells are trying to run into this lymphoid system, that's why you can find them located in many places, especially lungs, in the abdomen, in the pelvis, kidneys, bladder. That's how they run. So they are showing us now the lymphoid system, especially this lymphatic system, showing where they can follow. These are the inguinal nodes. Most of times you find that the nodes, the lymph nodes are swollen when the cancer is busy spreading. You see the swelling of the lymph nodes. When you touch them, you feel bulls or the small rubbery small tumors that you can feel. Mm? They can be under the armpit. They can be on the neck. Those will be showing whether there is cancer or other problems. So we said that you can also go to the bones. Apart from this X-ray showing the many problems actually on this X-ray, apart from intestinal problem and pelvic problem, we can see the bone. The bone is not right here. You can see also what you call osteophytes on this bone. And you can see, but in addition to that, you can see if this one has a very good space between each other, but here you cannot see. Imagine if it's a metastasis that already gone there, the bone will be broken into pieces as well. So it can go anywhere. It's complications we're talking about. And once it is already damaged the whole uterus, they might remove uterus and find something like this, which have damaged a lot, not only the vagina and the cervix, the fallopian tubes, everything is a problem. I repeat again, this is not for scaring anyone. Please, it's just to tell us that we need to prevent, and we can prevent until we stay safe. It's better to know than not to know and get surprised. So we should remember that cancer can be painful. Majority of patients will be under morphine, the very strongest medication that will be fighting pain. The pain is not only on the patient. The pain is on the children who have the mother who is sick. The pain is on the husband who need to care for this sick lady. The family, the whole family at large, the family is in pain. So the health systems are collapsing because if you get many numbers of sick people, then investment, the funds need to be invested into fighting these conditions that can be prevented from the beginning. Country at large, country having those problems, the health burden will be too high that a country will not develop. Instead of investing into developmental projects, schools, roads, hospitals, very interesting projects that other countries are doing, the developed countries, will be spending money on these conditions that we can prevent. Thank you for following this presentation once again. I'm inviting you to follow the following, which is the last presentation on this topic of cervical cancer, where we are going to see the treatment and preventive measures that you can put in place. Thank you very much, and I hope we are getting something. If you don't get anything, please raise up your hand and let's help each other. Thank you so much.